Congressman, how you doing today?
Jeff, I'm good for the shape I'm in based on what I've seen throughout this day so far.
It's crazy. And let me start with this, and I've been telling my listeners, I did go out to a restaurant today, and I plan to do that throughout the week to see how various folks are reopening. Have you had the opportunity to go out and actually dine in any place yet?
No, believe it or not, I'm in the People's Republic of District of Columbia today, and Virginia and D.C. and Maryland are just about as closed as you can get. So,
oh yeah, you're not going out. No. You're not sitting in a restaurant. You probably could, but you have to be like in a space capsule, or something like that.
The only way you can sit in a restaurant here is if you've broken in and nobody knows you're there.
Yeah.
I'm just telling you because.
Yeah. It's sad. It's actually sad to see. I mean, we joke, but it's sad to see because so many people are being affected. Well, okay, there's these hearings going on or with the Senate, and Dr. Fauci was kind of on the hot seat, and Senator Rand Paul was asking some questions, and basically was, hey, wrong prediction after wrong prediction after wrong prediction. You've been calling for Dr. Fauci to be out of this position for a long time.
Yeah, no, I thought Rand did a great job. And Fauci just didn't listen, and that's part of the problem with Dr. Fauci. I mean, I think he may have good intentions, but the bottom line is every model that he has used has been wrong. Every model and prediction he's made has been wrong. In fact, he himself has said that he's not relying on models anymore because all of them are unreliable. And with that in mind, he also confirmed today what he said multiple times previously, so I'm glad he was consistent. He said, look, I'm only looking at this one limited aspect of this thing, and I'm not looking at society, the impacts to society or the economy. Now, here's the problem with that. The policies that are being produced because of his narrow-minded view of things impact everything, the whole society, our civil rights, the economy, the community, the mental health, the public health crisis that's booming that we just don't talk about because it's being overshadowed by COVID.
Yeah, and look at this quote here. This is from this is actually from today's hearing. You'll still be homeschooling your kids this fall, Dr. Fauci says during a Senate committee hearing. Fauci said schools reopening in the fall is a bridge too far. I see that, and parents see that and say, what? Because we're still trying to just finish this school year. So, I mean, how could he predict anything that far out?
Well, that's the problem. I mean, what he was saying today, everything was consistent with what you just read, and that is, you shouldn't open all this stuff. This stuff should not be open. And frankly, he doesn't care. I mean, he said it. Basically, the economy, the societal implications, school, religious worship, etc., they're inconsequential to him. And what that means is your freedom, your liberty, your right to choose whether you will accept risk and go into the restaurant like you did, Jeff, or whether you're going to say, I feel uncomfortable going to a restaurant, I think I'll stay home. It's imperiled. It's imperiled right now. And Fauci is undermining that. And it's time for him to go. It's long past time for him to go.
Congressman Biggs, did he address this? And this is another article from USA Today. Dr. Michael Osterholm, he's the director of Center for Infectious Disease Research and Policy at the University of Minnesota. He said, this damn virus, it's going to keep going until it affects everybody it possibly can. It surely won't slow down until it hits 60, 70% of the population, a number that would create herd immunity and halt the spread of the virus. And this kind of coincides with what Governor Cuomo said last week, that he was shocked that 66% of the new cases were people that were quarantined in their house. I mean, I've been saying this for weeks. Isn't it just kind of hubris to think we can avoid this thing? I mean, we can use best practices, but I don't see how you stop this now that it's out there. And how is hunkering in our home going to help at this point?
Well, see, I'm not an expert, but I've talked to a lot of experts who share that same opinion, where they will tell you, and they're the kind that get booted off Facebook or they can't get on Fox or New York Times, and certainly CNN's not going to put them on there. But they're out there, and they're telling me when I talk with them, they say, "Look, here's our problem. you have to have herd immunity. You don't have a vaccine now. You don't know if you'll ever get a vaccine. You don't know if you're going to have some kind of curative medication or some other protocol. For this to burn itself out, you have to be in the community. It has to get spread. And what they're finding, a study today came out, 80% of the people in various settings, more than 80%, were asymptomatic. So this thing is spread further than we even know. Mm-hmm. And the other thing, too, is if everybody's in lockdown, it can't be surprising to Governor Cuomo that 2/3 of the people who get a new case of corona are getting it from their family. That's who they're with.
Yeah,
that's who you're with. So if anybody picks it up, you immediately go into this phase. But the reality is, you have to take care of your vulnerable population, and that's where we need to be. And you need to do it in a humane fashion, and really try to take care of those folks and the people that are caring for them. This business of locking you up, Jeff, while for other reasons might be valid, for the coronavirus issue is not going to work.
Well, yeah, I'm going to the coronavirus re-education camp because, I mean, I take this seriously, Congressman. I do. I mean, I'm out. I have the hand sanitizer. I see people. I don't choose to wear a mask, but I see people wearing masks. But I also see them wearing them, half over their nose and touching their face. And, and I try to use the best common sense as possible. But I can't live in a box. I just can't. We have to operate as a society. And I don't know how to get people over the fear can be extreme for a lot of people, especially vulnerable population. But I don't see how much longer we can let this. Arizona's opening up. Some places are opening up, but a lot of places are saying they're going to stay locked down till July, especially the liberal states.
Yeah. No, I think you're right. I look at it and I said to myself, a lot of this is fear-based. So I talk to a lot of constituents on a daily basis. I talk to other folks around the country. And this is my problem with Fauci, going back to Fauci, mm-hmm. is every time President Trump is out there optimistic saying, look, we need to open. It's the best way we can get, be a free people. We can get over this, et cetera. Fauci's a big downer, and he brings where Trump has faith and hope. Fauci brings fear and despair, and that's the problem. Is that a lot of people are afraid to go out. Good grief! You see people driving in their own car with a mask on their face. Who's going to give it to them? I saw a guy seriously. Yesterday, I'm driving DC, going to my office in the Capitol. I see a guy. He's probably 28 years old. Oh, he's buff. He's in fit shape. He's jogging. He's jogging. Nobody else is out on the road walking or anything, and he's got a mask on. I'm like, why are you wearing a mask while you are jogging? You are not. You're in perfect health. You're not in the demographic that is at high risk, and yet there you are with a mask while you're jogging.
Yeah, I'm surprised he didn't collapse. Maybe. I mean, hyperventilate from jogging. It's tough wearing those masks. I mean, I'd be more concerned about that.
Yeah, this is, and how about the folks that are driving a convertible BMW wearing a mask, for Pete's sakes? I mean, this is what you see, and that is media induced fear. Mm-hmm. So Fauci says, well, I just follow the science. I'm talking to a lot of scientists and experts, and I got to tell you, I'm not sure that Fauci's following the science. I think he's interpreting it in a way that is not really great. And the bottom line is he's a scientist. I'll give you that. I'm just a congressman, but I do talk to scientists who tell me that there is that lockdown is probably worse for us than opening up in a responsible fashion.
Yeah, and we'll see how this pans out. I mean, I expect there'll be, there's already been spikes here in Arizona, but that's because testing has increased dramatically, and there probably will be as we open up. But it goes back to that herd immunity issue. All right, Congressman Biggs, sometimes I got to look at these bills and these news headlines, and I think, is this like one of those fake news onion type things? Bill 6666, and it has to do with testing and contacting everyone and tracing things. One of your colleagues introduced this, I believe. What is this thing in a nutshell?
In a nutshell, what it is it's spending a lot of federal government money to provide an ability to spy on Americans without any probable cause. And that's what it is. And it's going to be a transfer to some high-tech company like a Google or somebody like that who's already doing contact tracing. They're not calling it now they're calling it contact tracing. They never called it that before, but now it's contact tracing, and they're going to be able to track you. And the next thing that'll come with that will be the immunity cards and those types of things that so many of my statist colleagues want.
So they're proposing a card like for you to travel and stuff, or show that you've already had the thing through the antibody testing.
Exactly. So first thing they want to do is they want to get the contact tracing, so they're spying on you. And then the second thing which is not in this bill, but which will follow this bill, they're already talking about this, and that is the immunity card. It's like a national ID card, but it says. Just think of it as a yellow star sewn to your chest or something like that. That's really how bad it's going to be. Everybody's going to have this immunity card, and if you want to go into a private business will be entitled to say, "Let me see your immunity card." If you're in some place that's a government building that requires everybody to be immunized, and you don't have an immunity card, mandatory vaccinations. I mean, you're talking a whole host of radical statist policies, and this is just one out there. And like the last bill that had contact tracing in it, they don't define contact tracing. It's just out there.
Well, Congressman Biggs, is there support for this thing? I mean, Democrat introduced it, I believe, but are you seeing it on your side of the aisle as well, or is this maintained to one side of the political spectrum so far?
Well, I hear a lot of my friends say that they don't support that particular bill, but in the last bill that they voted on, I voted no on the last bill. I voted no in part because of this very reason. They gave $12 billion of federal money for contact tracing just a few weeks back. So, it passed overwhelmingly in both House and Senate.
So something like this could be more in the open. And what I'm trying to get at here is so you use your phone, and let me try to contact tracing. Let's just explain this. I mean, you're out there, your phone has GPS, and it's basically you've checked in at this store, or it's just tracking your location the whole time. And just how does that work?
Well, yeah, I mean, they can track your location now, even with your phone off.
Mm-hmm.
They can track your location. You got your phone with you. They still know where you are. In fact, a report came out from I won't say the name, but a big tech company about three and a half weeks ago, where they started talking about they knew that certain groups, certain age groups, certain demographics in a certain location had stopped social distancing, and they knew that because they were ostensibly what they're calling contact tracing, but they were doing that. That's already being done. The question is, do you get federal money for it, and do you go after these guys for the invidious violation of privacy?
Yeah. Oh, well, and let's kind of play this out. I mean, this virus, like most viruses, I'm no expert either, but I imagine that in 6 months, 12 months, or 18 months, it's kind of run its course. But these types of bills, like Bill 6666, you can't make this stuff up, folks. Does it have a sunset that once coronavirus is gone, this bill is gone, it evaporates, or do they start using it for other purposes?
Well, my guess is they'll use it for other purposes. I don't know if there's a sunset clause in it, but one thing, if they're sunsetting it with the coronavirus, just remember this: that you had the Shanghai flu and the Spanish flu, both much more virulent than the coronavirus. More cases worldwide at the time, more deaths worldwide at the time. Those viruses all burned themselves out, except for they're still existing somewhere in nature. Mm-hmm. And so if you're banking it on that goes away when coronavirus goes away, coronavirus is probably always going to be around. The question is how dangerous will it be going forward? And that's part of the issue that we face.
Yeah, it's kind of like let's do $2,000 a month to folks until we return to pre-coronavirus, 5% unemployment. That could be 10 years. We don't know if this was an act.
Yeah, that's right.
Okay,
that's right.
Finally, go ahead, Congressman.
No. You're right. You're right on the money.
Yeah, and finally, Congressman Biggs, Pelosi has some spending ideas. I haven't heard as much. Yeah, I haven't heard as much of stimulus number whatever we're up to next. Is it being worked on? What's coming? What do you see coming here on the spending side and the stimulus side?
Okay, here, you sit down for this.
I have to every time.
She introduced a bill today, spending $3.4 trillion. Let me repeat that: $3.4 trillion with a T dollars. So that is double all the other relief packages. Excuse me, I don't mean double. It is more than all the other relief packages put together, which were right around $3.2 trillion.
Mm-hmm.
So I got to believe that it's, in her mind, it's just a marker to begin negotiations with, because she's starting at 3.4 trillion, and even if she negotiates that on down, think about that. That goes down to if she's able to even keep half of what she wants, that's $1.75 trillion, and that means that you're pushing really $6 trillion in our structural deficit this year, which means that we'll be set somewhere at 5. We're at 23 now, so you're somewhere near around $28 trillion, $29 trillion by the end of the fiscal year. That's how I'm saying, and it covers the whole gamut. It's just everything that a statist, a leftist would want is wrapped up in this bill, expanding policies, things that have absolutely nothing to do with this. And when you're talking trillions of dollars, she's got $100 million here, $100 million there. It just doesn't seem so much to $100 million, where some of those agencies not too long ago, if you were giving them $2 million,
yeah,
you'd say that's probably too much. But now she's throwing $100 million here, $100 million there.
Unbelievable. Well, keep an eye on that one and let us know soon where it lands, because is it going to go to you guys for a vote? Are you guys back now working?
I'm back in D.C. working, hoping that one day that Pelosi will treat Congress as an elected body instead of as her lackeys, as a dictator. And so I anticipate probably if any of the gap goes here, that you might end up maybe sometime next week voting on this would be my guess. My guess. Let's
see how it goes. Let's see how many of your colleagues join you. If you decide not to support this future one, as you did in the past, not support it again. All right, Congressman Biggs. Hey, I really appreciate the updates. People don't know people are so wrapped up in their lives, and this has hit so many people so hard that they barely know what's going on in their local government at this point. And to think about what DC is doing, it's mind blowing. So thanks for keeping us up to date.
Yeah, absolutely, Jeff. Thank you. Thanks for what you do.